Hey everybody, my name is Kevin. I'm the Chief Operating Officer and Senior Data Scientist here at Enlitic, and we are working to develop applications of artificial intelligence in healthcare. This particular application that we're working on here is a tool to triage chest x-rays. In particular, we're looking to build models that can first and foremost separate normal from abnormal chest x-rays, and then beyond that, further characterize the abnormalities by pointing out the particular primary patterns that we've detected within the image. The final phase of the development we're doing here is to try to take those detected patterns and use them to generate a differential diagnosis. But in order to build the models that will perform these functions, we need to collect a massive amount of training data to inform our algorithms. And that's the purpose of this video, to set forth guidelines and instructions that can aid you in helping us collect that data set. And my coworker here.
So my name's Anthony Upton. I am the radiologist advisor to Enlitic, and I'm responsible for creating the labeling system that you're about to use to assist us with achieving the goals that Kevin's just outlined. So the next part of the video, we're going to talk about some of the important instructions to assist you with actually using the labeling tool. It is really of critical importance that you understand the instructions very well. They're designed to help and encourage everyone to actually continually to refer back to the instructions at any time if you've got any queries. And also, if you've got any queries at any time, you can message Enlitic.
Yeah, and this document that you see open here on the screen now is that instruction sheet that we're referring to. We'll send this out to you, so you should have a copy of it. Again, we heavily recommend that you read the document several times prior to beginning any labeling work. And any questions that you might have for myself or anyone else on the team, there's also a link in this document right here to a Slack group that we've put together for you and the rest of our radiologists to use to communicate about any questions, comments, or concerns that you might have while working on this. Any questions that you have at all, please let us know through the Slack channel. It's much better to ask than to move ahead with any kind of unanswered questions. But as we mentioned, the real purpose of this video is to offer you further guidance beyond this document to help you in labeling these cases. So to begin, we can start to walk through some of the specifics of the labeling scheme and some of the particular guidelines that we've set forth that we recommend when looking at each of these images.
Yes, so really the most obvious and first thing to do, and some of the areas that we've seen to this point, is you need to look at every image that's provided. There will be abnormalities that require labeling on both the frontal and lateral views. They can be presented in a number of ways, so I don't know if you just want to open up quickly an image. So you can see the thumbnails in the top left-hand corner. So this particular case has one series, and there's a number 2 imprinted over that, which means that there are 2 images within that series. You can toggle using the up and down switch keys on the keyboard to toggle between those images. So just make sure with each case you've mentally checked that you reviewed each image.
And we could see real quick if this one's also got 2 in the series. Let's try to find. And here we can see an example of a case that has 2 separate series, each of these series only having a single image in it. That's really the only 2 ways that this scenario would present itself. You'll either have multiple series or multiple image in each series.
Yep. Okay, so as Kevin has mentioned, what we're doing is a pattern-based analysis of the images, and after we go through the instructions here, I'm going to walk through about a half a dozen cases with everyone so they can see how to practically use the tool. What we want the labelers to do is to label what they feel is the primary pattern in each X-ray that would indicate a different pathology. So there may be multiple primary patterns within each X-ray, And if that's the case, then we want you to label that. What we don't want labelled is any secondary patterns that might arise from the primary disease or the primary pattern. We want to capture just all of the information with the primary pattern. So one of the examples that we'll show you of a primary and secondary pattern is that of pectus excavatum. That can cause secondary effects like blurring of the right heart border, which can appear as if there might be consolidation there. We don't want that labelled separately. All we want is the pectus excavatum label. The next thing is quite an important point, and one to really try and understand. If you're undecided about the presence of a primary pattern or not, and that's the trouble that we always have as radiologists, we want you to err on the side of caution, and if you feel that that pattern is of high clinical relevance, then we want you to label it. Okay. If it's not really of high clinical relevance, then it's probably okay not to label it. So just to give an example of that, if you're wondering, if you're vacillating whether you think that there might be an interstitial infiltrate on the X-ray, we would rather that you labelled it than not label it. If you're just wondering whether there might be a tiny bit of arthritis in the spine, it doesn't really matter if you label it or you don't.
Though if that arthritis was very clearly there, you should label it.
Yes. If the chest X-ray is completely normal, the process is very simple. You don't have to label anything. All you have to do is hit the blue key down the bottom of the labels on the right-hand side, which is submit and next, and that will take you through to the next case.
Here you can see, by the way, an example of one of those cases. Down here is the submit and next button. If the case is completely normal, then you don't need to check any of these boxes. You can just go ahead and click submit and next. But of course, if there are primary patterns visible, then those would be coded using these checkboxes here.
As I've said before, if you get an X-ray where there are multiple primary patterns, and we'll certainly show you cases of that, then you need to label each of those primary patterns, okay? And I'll show you in the examples how to do that. We don't want normal age-related findings to be labelled. So an example of that may be senescent tracheal calcification. It's not considered to be a disease. Things such as calcification in the aorta from atherosclerosis, we do want labelled because that is actually a pathologic entity. So it can be difficult when using the system to know how specific you can get with it. Again, we will show you some examples where you can have difficulty with that to try and help you navigate through that. As a rule, we want you to be as specific as possible with a high degree of confidence. If you're not confident, only label down the ontology as to the point where you're absolutely confident. If there is an abnormality that doesn't seem to fit into any of the categories provided, you can use the other category if necessary, although we want to minimize that as much as possible. And if you use the other category, there's a text box to use to put a description of that category in there, of that abnormality.
Yeah, and as we just mentioned, if you use the other box, please include a description, and that also applies to any technical or imaging issues as well.
Similarly to applying a specific primary pattern, it's important to be as accurate as localizing that abnormality as well. If you can't use an exact anatomical localization, then there are other options. So a common thing would be trying to localize lung pathology to a specific lobe first, if you're able to do that. If you're unable to do that, then the next step down the ontology would be to label it to a particular zone.
And if you accidentally submit a case before you've labeled all of the patterns of interest, then you can go ahead and just click back in your browser. That should bring you back to that particular case so that you can make any necessary edits and resubmit it. But if you do realize that you accidentally changed a case, then please do try to fix it. If for whatever reason you're not able to fix it, then please let us know on Slack. So just to reiterate some of these rules here and kind of the goal of what we're out for here, really we're trying to build a system that can identify suspicious patterns, not necessarily the specific diseases that they're suggestive of. We're really going along with this methodology because we hope that it will enable us to build a very robust system that's capable of detecting essentially any kind of abnormality, even if it's one that we don't have specific examples of. And we also feel that this approach will give us the best ability to differentiate normal from abnormal cases, which is really the primary goal of the exercise that we're doing here. And again, please make sure that you fully familiarize yourself with everything in this instruction document, as well as the contents of this video, and reach out to us on Slack if you have any concerns before beginning. And if you haven't been set up on Slack yet, then please let me know. My email is kevin@enlitic.com if you don't have it, and we'll get you set up on Slack right away.
The other important thing is to expand each of the categories in the labeler as well, to see how many subcategories and what the content of those are, and just to be very familiar with those, so you know the range of options that are available to you. The expanded version of that will also be at the end of the instruction document for you to refer to.
Yeah, and as Anthony just mentioned, we'll include all of these drop-down items in the document so you can see them. But we heavily recommend that you just spend a little while playing around so that you can see all of the different sub-options under each group, just to get a sense of the options that are available to you. So it may be useful before you begin to know that airspace disease and interstitial disease, nodules, etc. are options underneath pulmonary parenchyma, just as it may be useful to know that plethora and oligamia are options under pulmonary vasculature. Just play around with it for a bit before you begin actually labeling cases.
So now I think we'll just spend a little bit of time walking through some of the major pattern categories. I think as radiologists everyone should be familiar with them, so I'm not going to spend a lot of time talking about these, but just maybe give some examples of some diseases that you might put into each category and where some of the issues can arise. Obviously everyone knows that chest x-ray interpretation is an extremely difficult thing, and there is a lot of subjectivity within it and a lot of heterogeneity in radiologists' opinions about it. By doing this, we're trying to minimize that heterogeneity as much as we can. So after this I'll talk about some of the specific instructions with anatomical localization, and then we'll launch into a visual demonstration of how we actually label some cases. So the first number of categories here refers to problems with the lung parenchyma. So airspace disease is a common thing, you know, consolidation of any cause. So we're not particularly interested in what the cause of that is, whether it's pneumonia or pulmonary hemorrhage. So anytime you see consolidation, just tick that box and localize it. One of the common issues that we do get is that of scarring. I mean, that is a pathologic or histologic entity. Scar can look like a number of different patterns on an X-ray. If you think something is an area of scarring, just label it under what you feel the most appropriate pattern is within the labeler. And that may be interstitial disease, it may look like a nodule or mass. So whatever you feel is appropriate. Interstitial disease, again, doesn't really need any explanation. It covers all of the different subtypes of interstitial disease. So whether it's just reticular, reticulonodular, or micronodular. So common diseases that would cause these patterns are the idiopathic interstitial pneumonias, interstitial pulmonary edema, lymphangitis, carcinomatosis. Sometimes bronchiectasis can be mistaken for an interstitial pattern. It doesn't matter. If you see an abnormality that looks interstitial, then label it as that. Nodule or mass, again, it doesn't matter about other characteristics within that nodule or mass, so it doesn't matter if it's calcified, cavitating. Label, if it is a nodule or mass, label it as such. Again, it is irrelevant what the cause of that nodule or mass is. I guess the one point here is if you've got micronodular disease such as miliary TB, to label that under interstitial disease. Pulmonary cysts, again, self-explanatory, just label them and localise. Altered lung volume is a category that can cause some issue. It's very important to try and differentiate a truly hyperinflated lung from a pathologic disease such as any cause of chronic airway obstruction, so emphysema or chronic asthma, from a hyperinspired chest x-ray, particularly in young patients who are just able to take a very deep breath in. We've added a link here to Radiopedia, which has a very good summary of the radiological signs of hyperinflation, and I would suggest that everyone opens the link and refers to it, particularly at any time where you're uncertain as to whether a X-ray that the chest is truly hyperinflated or hyperinspired. It's probably the one category where we would urge caution of probably undercalling it a little bit rather than overcalling it. Pulmonary vasculature, again, the two options here is that it's either prominent or plethoric or reduced, so oligemic. Common causes of that would be pulmonary venous hypertension from left ventricular failure or any cause of an intracardiac shunt. And oligemia, the classic cause of that would be pulmonary embolism. The bronchial pattern refers to anything that causes a thick-walled and or dilated bronchus. The most common cause of that you will see on these x-rays is bronchiectasis, but there are other patterns, other diseases that will cause that. An abnormal hilum, again, we're not being specific about what the cause of the abnormality is, but anything that alters the size, shape, position of the hilum, regardless of whatever structure within that hilum is causing that, we want to be labelled as an abnormal hilum. So if there's a hilar mass from a bronchogenic carcinoma, that will go into this. If there's lymph node enlargement from lymphoma, then that would go into this category as well, or other things like enlargement of the pulmonary artery from pulmonary embolus or pulmonary hypertension. Diaphragmatic abnormality is, again, simply that any focal or generalized abnormality of the diaphragmatic contour or position needs to go into this category and just be localized to whether it's the left or right diaphragm. Pleural abnormality is, again, self-explanatory. There are a number of subcategories, whether it's pleural fluid, mass, or pneumothorax, that need to be anatomically localized. As we're going through the cases, and the anatomical localization instructions, I'll talk briefly about what a diffuse abnormality is and a focal abnormality, which will help with localizing that. Extrapleural chest wall, so that's everything outside of the lungs, and mediastinum. There are a number of subcategories within that to assist with the different compartments within that need to be localized. So this involves anything of the rib cage, for instance, the skin or soft tissues, and there will be appropriate labels there to assist with that. The mediastinum obviously refers to mediastinal abnormalities. Again, we don't need to be specific necessarily about what the abnormality is, but these would include things like enlargement of the heart, aortic ectasia or aneurysms, and hiatus hernias would be the common things that are in the chest x-rays. Spine abnormality is any abnormality of the visible spine within the film. So that is predominantly the thoracic spine, but also includes the visualized bits of the cervical spine and lumbar spine. Those abnormalities can either be diffuse, such as osteoarthritis, or focal, like compression fractures, and will be labelled as such. Anatomic variation is an important category to label, and the reason for that is we don't want the algorithm to interpret an anatomic variation as being pathologic. So we need to identify these. The common anatomic variations that we've seen are azygous fissures and azygous lobes, large epicardial fat pad, which can mimic disease, and sometimes the inferior pulmonary ligaments. Foreign body is also an important category. it's been divided into medical devices / traumatic implanted foreign bodies. So that would include things like pacemakers, central venous catheters, ECG leads, or surgical clips. The other category is an extrinsic foreign body, and the most common items you'll see on the x-rays are jewellery and clothing. The next category, again, is very important for the same reason that anatomic variation is important. We don't want the algorithm to interpret technical issues as being pathologic, and so it's important to check this box and put a descriptor of what that technical issue is. So the most common thing that we've encountered are expiratory films, which obviously can make the chest look quite pathologic. Same with rotated patients, MAC effect, and another is collimation artifacts attenuating the X-ray beam, and we have examples of that later. Also, if you see any IT issues with each image, it's important to check this box and write a description, and we will check what that issue is.
Yeah, if you're unable to view the image for whatever reason, then the first thing we recommend is that you try to refresh the page. But if that doesn't fix the issue, then go ahead and check this box and leave a comment to let us know your problem.
The other category is one that we would like to be used as sparingly as possible. Its main use really is for anatomic regions outside of the chest and chest wall. So here we're looking at shoulder girdles, lower neck, upper abdomen, and we have a number of localizing labels for that as well. Evidence of prior surgery is a very important category as well. It gives us an indication that a lot of the patterns that have been ticked relate to a previous operation, which obviously can affect the differential diagnosis of that pattern. So any time that there's any visible effect of surgery, so whether there's surgical clips or parts missing, such as a breast, it's important to tick effect of prior surgery. We don't want you to stop just by saying effect of prior surgery. That you then need to go on to the other labels to pick what patterns that's caused. So if there's been a lobectomy, you might tick evidence of prior surgery, pulmonary parenchymal volume loss, foreign body medical device because of the surgical clips, and a chest wall rib abnormality because of the thoracotomy. So it's important to encompass all of the labels, not just the fact that they've had surgery.
So the next bit that we'll talk about are some of the guidelines around localizing the particular abnormalities or patterns that you're pointing out. To kind of talk through where that comes into play, as you use these checkboxes here to code the primary patterns that are visible, it'll ask you to get more and more specific in defining the pattern, and eventually you'll get to a point where it begins to ask you about localizing that abnormality. And each pattern has only the localizers available that kind of make sense for that particular type of pattern. So, for example, if we're coding something that we believe is airspace disease, eventually we'll get to a point where it's asking us whether it's diffuse or focal multifocal. Just for example's sake, we can say that it's diffuse. It will then ask us whether it's localized to the left or the right. It's perfectly acceptable to say that it's both. Or you can say that it's just one. And once you've said that it's on the right, it'll ask you to further localize that to the lobe or the zone because this is an abnormality that exists in the lung. And you would just code it to the degree that you are capable of given how specific the image allows you to be.
Yeah. So as we mentioned at the start of the video, be as specific as you can to the point of your confidence. So if you can localize it to a lobe, then do so. If you're unable to localize it to a lobe, then localize it to a zone, and those options are given to you in the labeler.
And that covers the first point here in the localization guidelines. If you want to talk through the next point.
I have to read the next point. So if the next point really refers to where a pattern can apply to the whole region that's involved. So a common thing would be the spine, for instance, involved with arthritis. If you see arthritis at every level, there's no need to go on and localize to check every thoracic spine level within the labeler. All you need to do is check spine abnormality and arthritis, and then you can leave it as such. So don't go on and check all the boxes. I don't know if you want to quickly...
Yeah, we can quickly show that real quick, so I'll open up this case. So let's say, for example, that we believe that this particular patient has scoliosis or spinal curvature. Then we would go to spine abnormality and curvature. And you can see here that now it's asking us to localize this to the particular vertebrae where this abnormality or pattern applies. But because it applies to all of the vertebrae, then we would just leave it at curvature. We wouldn't bother checking off each of these boxes here.
Yep. The next instruction is an important distinction for everyone to understand, and this is how I guess we've defined focal versus diffuse abnormality. So the next few bullet points here refer to that. So a focal abnormality is a solitary abnormality confined to a specific anatomic region. Multifocal abnormalities are multiple focal abnormalities in multiple discrete anatomic locations where there's intervening normal tissue between those locations. So a focal solitary nodule is a focal abnormality. Multiple nodules with intervening normal lung parenchyma is a multifocal abnormality. Similarly, you can have focal consolidation, an area of consolidation, or multifocal consolidation with intervening normal tissue. Where there is multifocal abnormalities, and we will limit this to somewhere between 2 to 5, if you can please try to localize each of those abnormalities within the labeler. So the labeler will allow you to tick as many boxes as you need to localize them. If the number of multifocal abnormalities is overwhelming, so more than 5, all you need to do is label a few of them. So up to 2 to 5 of those. You don't need to label each individual case, each individual abnormality. A diffuse abnormality, to contrast that, is one that we've defined as confluently involving an anatomic region or part of an anatomic region where there is no intervening normal region in which the area of pathology is located. So the example of that is lobar consolidation. So that will diffusely involve all or part of a lobe, whereas bronchopneumonia will be a multifocal abnormality where you have normal intervening parenchyma between the areas of consolidation. Importantly, we've also defined a free pleural fluid as being a diffuse abnormality because it diffusely or confluently involves the portion of the pleural space that it involves, whereas a loculated pleural effusion would be a focal or multifocal abnormality because there will be regions of abnormal pleura separated by normal regions of pleura. If the abnormalities are bilateral, as Kevin showed before, please tick both the right and left boxes in the annotator and then go on diffuse or focal multifocal and step through the labeler as we've shown you.
So that about takes us through this instruction document. There will also be a couple of examples in this document as well, including the pictures and the final tags that we've associated with them. But now we'll actually step through some examples, and Anthony will read some cases for you and step through the logic behind how we arrived at the particular patterns that we've chosen to label for each of these examples. So feel free to refer back to these to try to get a better sense of the logic behind some of the localization and pattern guidelines that we've set forth here.
We will also include these pictorial reviews of these images with their associated labels for everyone to refer back to at any time.
So when you start labeling with us, you'll log into the image annotator tool. You can see the URL for it up here, but we'll also include that in the instruction document. And you'll log in with your email address and password, If it's your first time logging in and we've already set you up, then go ahead and use the forgot password form in order to reset your password and log in. But once you've logged in, you'll see a screen like this. This is your work list. Presumably you're used to seeing something like this. And this will list all the tasks that we've set for you to go through. Here you can see that I've got 7. The first set of cases that you'll go through will include about 50, and that'll give us a good sense of your performance on this particular task. And we'll use that to QA those cases and then get back to you with feedback or anything that we've noted about how to move forward. After we've had a chance to discuss your results with you on the first 50, then we'll open you up to start labeling as many chest x-rays as you'd like. Once you're at that point, the work list will usually only list one case in it, but every time you hit submit and next, it'll load a new case for you. So there should be potentially infinite cases after you've gone through that first 50. But to select a case to begin labeling, just click Start, and that'll load the case up. Depending on where you are and what your bandwidth situation is, it may take up to 10 or 20 seconds to load a particular case. If it takes more than half a minute or a minute and any part of the frame isn't loading, then try to refresh it a couple times to see if that helps. If you still can't load the case after that, then let us know via Slack and we'll try to help you fix the problem.
So this is the refresh key to hit, or you can go back to the tasks and reload it again if it hasn't loaded properly. So let's begin on the first case. So we're going to step through these probably from easier to incrementally harder, and just to show a few examples of things that may need to be labelled uniquely in our system. The system is not comprehensive, and some of the labels within that may seem a little bit unusual, but they're designed to cover the things that we see most frequently within the X-rays. And having used the system quite extensively now, there hasn't been an abnormality that we have not been able to label adequately with the system. So the first case is just got some common labels that you will use all the time. So again, we can see that there are 2 X-rays within this series. You can just scroll with your mouse between the 2 series or hit the up and down key on your keyboard. Occasionally it will view as a small, the second image will view as a smaller, so you can hit the magnify button to magnify that up so you can have a look at it. So one of the obvious abnormalities that we can see here is ectasia of the aorta. We don't have my label. Okay. So here we will hit spine abnormality. We will hit mediastinal abnormality and ectasia and aorta. When we look at the lateral view, it's also clear that there's some arthritis of the spine here. It's at multiple levels, so it's a diffuse abnormality. So we click spine and arthritis, and as we've mentioned, because it's diffuse, we don't need you to label at what levels it is. And once that's done, we hit submit and next.
And this may take a couple seconds before the case goes through, but you can see after we wait a couple seconds, it loaded just fine.
So, as I promised, we're getting now to a harder case. So again, there's one series with 2 images, so just scrolling with the trackball and the mouse, we can see both of the series. So the first thing that we'd note is that there is a curvature of the spine. So we click spine abnormality curvature. So it's important to realise that that curvature is in any direction. It doesn't just refer to scoliosis, but it refers to lordosis and kyphosis as well. We don't need you to specify what it is. Again, it's a diffuse abnormality through the spine, so there's no need to check the individual boxes. Also, I can see that there is some perihilar consolidation in the right mid zone. I can look at the lateral to see if I can help localize that further. It's probably within the right lower lobe, but it's hard to tell for certain. So we would check pulmonary parenchyma, airspace disease. It's a diffuse abnormality within that area. It's localized to the right, and we'll call it the right mid-zone. Also within the lower zone, there's a number of ring shadows here, and we can see some thick-walled bronchi here. So I think that there is probably a bronchial abnormality. So go to bronchial, focal, multifocal, right, and right lower lobe. Going back to the frontal, both costophrenic recesses are blunted. So this is a pleural abnormality. I think that there is pleural fluid. I don't think it's loculated, so this is a diffuse abnormality. I think it's both in the left, and I think it's in the left lower zone, and I think it's in the right lower zone. The aorta is also ectatic. So we go to mediastinal abnormality, ectasia of the aorta. Also, there's a technical issue with this in that the film is probably taken during an expiratory phase. There's only 5 or possibly just the 6th rib that's visible. So we go to technical imaging issue and write, as we said, anytime you check that box, you need to write a description of what you think it is. So expiratory study. So as you can see, there's quite a number of abnormalities within that, and each one of them can actually be labelled quite easily with the annotator. Just don't get overwhelmed by ticking all the boxes. Just work through each problem or pattern that you see systematically, and then once you're done, you hit submit and next. So the next case, it's got 2 series, each with 1 image. So having a look at the frontal and then have a look at the lateral. So to me, this looks like a case of cardiac failure. You can actually measure the cardiothoracic ratio. You can see that there is cardiomegaly there. So mediastinum, enlargement of structure, enlargement of the heart. Also within the mediastinum, the aorta is ectatic. So we go to ectasia, aorta. There's also calcification within the aorta. So calcification, aorta. I think that the pulmonary vasculature is prominent. So we go up to the pulmonary vasculature box, pick plethora. It is a diffuse abnormality throughout the pulmonary vasculature. It involves both the left and the right, and it is prominent throughout the chest, so there's no need to label which particular zone it is. So it involves upper, mid and lower zones. There also are probably a few interstitial lines, so suggestive of some interstitial edema. So we go to pulmonary parenchyma, interstitial disease, focal, right, lower zone. There's bilateral pleural effusions. So pleural abnormality, fluid, diffuse because they're not loculated, left, lower, and right, lower. Looking at the lateral view, we can see that there is probably a few osteophytes in the spine. So there's a diffuse spine arthritis. And again, because it's diffuse, there's no need to label which level it is. So that takes you through the labels that would be required with a case of cardiac failure, and that's something that you will see in the cases that you're presented with, and so you can refer back to this to see how you label it if you have any trouble. Once we're done, we hit submit and next. The next case again, 2 series with 1 in each series. Have a quick look at the lateral view before we start. Very clear on the lateral view, and probably was clear on the frontal view as well, that there is pectus excavatum deformity. That is causing a secondary effect that we cannot see the right heart border, which can be interpreted that there is consolidation there, but because of the pectus excavatum deformity, we know that that's not the case. So the primary pattern here is a chest wall abnormality. It's not a fracture or a mass, so in this case we're going to tick other. It is the chest wall, and the abnormality is in the midline. And because we've hit other, we need to go into the description and hit what it is, and that is pectus excavatum. Importantly, as I've said, we don't want you to go now and label pulmonary parenchyma consolidation. This is a secondary pattern, secondary to the primary pathology, or the primary pattern, which is the chest wall abnormality. Once we've done that, we're done with that case. So as we can see here, sometimes it takes a little bit of time for the labelling tool to come up. So as Kevin mentioned, we either wait for about 20 seconds.
Yeah, and at this point we've given it some time to appear, so it looks like it's likely not going to pop up, so we can go ahead and refresh, and hopefully that should fix the issue. It may take a couple of refreshes to get the system to load. But if it doesn't load beyond that, then you can just go back to your task list and select the top case from your list again.
So as you can see, every time we end a case, it disappears from the list. So there's only 3 cases left.
There we go.
So when we've reloaded it, you can see that the annotation tool has come up. This case has an artifact on it, which is what we wanted to show. There's also a number of other abnormalities. I can see a nodule in the right mid-zone here. See if we can localize that on the lateral view. So it's around the level of the hilum, so I'm unable to see it on the lateral view, so I can't ascribe it to a specific lobe. So we'll label it as pulmonary parenchyma, nodule or mass. It's a focal, it's in the right, and it's in the right mid-zone. There's also clearly ectasia of the aorta. So this is mediastinum, ectasia aorta. There's also what we would label as an interstitial abnormality. It's a vertically oriented line in the left lower zone. That may be an area of scarring. So this would be a focal interstitial abnormality in the left lower zone. Uh, there also is a foreign body on this film with the eye of faith. So this button here, again, I'd urge everyone to familiarise yourself with the tools that are available to you. You can just see the top of a foreign body below the diaphragm on the right, and it's more visible on the lateral view. This is an IVC filter. So this will be labelled under foreign body. That's clearly a medical device, and it is located in the upper abdomen. You can, if you want to, write what that is, but it's not necessary to do that. The last thing to note, and we do want people to label these subtle things, that there is an artifact from the dirty screen over the right scapula. So that is a technical imaging issue, and anytime you check this box you need to write a description, and you can write whatever you want to, something to this effect. Is fine, because we will read all of those comments. And once you're done, again, hit submit and next. So this is a case to demonstrate what you do when you don't know what to do. And when we labelled this, that's precisely what we did. And it's just the importance of knowing when to stop on the labelling system. What we don't want is that if you clearly can see an abnormality that, for instance, might be pleural, but you're uncertain as to whether it's a mass or fluid, or what its location is, it's important still to put that there is a pleural abnormality, because if you're certain of that, then it's important to capture that piece of information. Don't, if it's abnormal, just hit submit and next if you don't know how to label it. Either put what you know to label, or if you're uncertain about it, contact us on the Slack channel and we'll help. So really, just to focus on the major abnormalities in this case. There's one series with 2 images. I won't go through the spine arthritis or enlargement of the heart with this. There is a retrocardiac mass with an air fluid level, which you can also see on the frontal view, which is a hiatus hernia. So for that we would go to mediastinum. That is a mass, and it is in the posterior inferior mediastinum. Again, there is no need to label what you think it actually is. The other thing to note is that there are the patient has had a prior thoracotomy, midline thoracotomy, so they've had surgery, and there are obviously therefore foreign bodies. They are medical devices. There are medical foreign bodies in 2 locations. So one is the chest wall in the midline, and that refers to the sternal sutures. There are also pericardial clips, which you can see if you window the lateral view. So these are in the mediastinum, associated with the heart. So as I've said in the preamble of the instruction video, it's important not just to tick effective surgery, but to label all of the effects, including whatever foreign bodies that there are there. Also in this case, the heart is enlarged and that there is some arthritis in the spine, but you do note on the lateral view that there is a line that's paralleling the chest wall. That is almost certainly a pleural abnormality, but it's very difficult to see, to localise it any further than that. It's probably on the left, but I'm not certain. There is some opacity on the left that's not normal. So in this case, if that's all you're comfortable with, all you have to do is tick pleural abnormality. If you think it's fluid, and it probably is because there is a relatively straight, or there is a straight line, it may be a loculated effusion or empyema, you can tick this if you want to. But but because I can't tell, if I think it's fluid, then it has to be, and I think it's loculated, then I can tick it as focal or multifocal. But because I can't tell if it's on the left or right, I can leave that blank. If you can't tell that it's fluid, it's enough just to leave it as a pleural abnormality. And then again, once you're done, hit submit and next. The last case kind of brings all of these things together, so this is quite a complex case. One series with 2 images in it. So you can pan the position of the image. One of the slight bugs in the system is that once you zoom one image, it will zoom the other, so you may have to unzoom that and pan it to where you want to. First thing to notice is that there is a collimation artifact. Again, probably our brains are trained not to look at this, but we want you to label this because the algorithm will see that as abnormal if we don't. So there is a technical imaging issue. And then just put a description of what you're seeing. And going back to the frontal image, there are clearly multiple foreign bodies, medical devices. So there's a central venous catheter. So medical device that is in the chest wall. Part of it is in the chest wall to the left, and then it is within the mediastinum, superior and heart. There are also ECG leads, which are on the chest wall left and right, and midline. In addition to that, there is a hilar mass. So this is an abnormality of the pulmonary hilum, and it is enlarged on the right. There are a number of rib fractures. When labelling rib fractures, these are focal abnormalities. It doesn't matter if the fracture is acute or chronic. There is a deformity of the rib that is due to fracture. So we will go to chest wall, extrapleural chest wall, fracture, rib cage, and then label the appropriate ribs. So there's 1, 2, 3, 4, 5, and 6. So ribs 4, 5, and 6. On the lateral view, and it may be hard to see, but there are a number of surgical clips in the mediastinum, which has been covered by the labels that we've already got. Also, you can see that there is some slight volume loss within the right lung, which is possibly secondary to the slight collapse of the chest wall from the rib fractures. So we go up to pulmonary parenchyma, reduced lung volume diffusely on the right. And then if we're happy with that, submit the case.
Great, so I believe that takes us through all of the examples that we've set forth to kind of show you guys and walk you through as part of this exercise. As we mentioned before, all of these examples will be included in the instruction document. And if you have any further questions that aren't covered as part of this video or the document, again, please reach out to us on Slack. We'll try to be as quick as possible about fixing any bugs or answering any questions. Try to post all of your questions in the chest x-ray triage channel, which I believe we've outlined right here in the document. By doing it in that way, we can make sure that everybody on the channel can see your question, and that should help us out quite a bit in helping everybody. But that's about it for this video. If you have any questions, again, please let us know, and otherwise, good luck with labeling.
Good luck. Hope to hear from everyone.